Here's our 213 project. Our ethical dilemma is nurses who smoke but educate patients on smoking cessation. Our group members are me, Andrew, Georgette, and Giselle. There are many nurses who smoke even with the knowledge of the health risks. According to campaignforaction.org, 36.5 million Americans smoke, and this includes 7% of registered nurses and 25% of LPNs. We sought out to find if nurses should be allowed to smoke, and does a nurse who smoke have an impact on the smoking cessation of their patients?
I work at a hospital. I'm a maternity nurse, and nurses as a group smoke a lot. That was where I used to do most of my smoking. How I ever did it when I was so busy, but a lot of them would just burn out in the ashtray in the locker room. But everybody wanted to get off the floor to get a cigarette, and doctors have been pretty successful at quitting, but nurses not so much. And my personal feeling is that it's a powerless position in a lot of ways. You're busy doing an awful lot of work, and you've got a lot of responsibility, and it's very stressful at times. I don't think it's just nurses, I just think it's people in helping professions tend to have cigarette problems or addiction problems because they're taking care of everybody else's needs and not meeting their own.
I smoke when I get home from work. It's just nonstop. And during the night, I wake up every couple hours and have a cigarette. Fell asleep with a cigarette, I guess. And then my mother woke up. She walked in the room. My nightgown just burned off me. And I had first, second, and third degree burns all over me. And it didn't stop me either. I can't take a deep breath. I cough all night long. It literally hurts in my chest constantly. But I can't seem to stop. I guess I don't care.
Current research shows smoking results in 1 out of 10 adult deaths worldwide. This adds up to 6 million people a year. Included in this figure is 600,000 individuals that do not smoke, but they're victims of secondhand smoke. By 2030, the World Health Organization estimates that the death toll will reach 8 million annually. Tobacco use attributes to both cancer and cardiovascular disease, which are major causes of premature death. According to the Healthy People 2020, tobacco use costs the U.S. $193 billion annually from lost productivity and direct medical expenses. Smoking has many negative effects on the body. Tobacco products are made of extremely toxic materials. Tobacco smoke contains more than 4,000 chemicals, of which at least 250 are known to be harmful, and at least 69 are known to cause cancer. Smoking is a known cause of the top 5 health conditions impacting the U.S. population: heart disease, cancer, cerebrovascular disease, and chronic lower respiratory diseases. Smoking is estimated to cause nearly 164,000 cancer deaths among smokers each year in the United States. Some cancers that are caused from smoking include lung, mouth, throat, bladder cancer, and some other cancers of the body. Evidence-based practice that has been commonly used to help patients with smoking cessation is the 5A model. The first A is ask the patient about their tobacco use. If the patient smokes, advise them to quit. The third A is assess willingness to quit, assist the patient's attempt to quit, and then arrange follow-up appointments. The National Adult Tobacco Survey findings showed individuals who received the 5A model intervention during their visit to a healthcare provider had significant increases in the use of tobacco cessation counseling and nicotine replacement therapy. Nurses that routinely use the recommended 5A algorithm can create a lasting impact on the health of their patients. So how does this relate to nursing? An estimated 7% of nurses smoke, compared to only 2% of physicians who smoke. Nurses are on the front lines of smoking cessation. One of the first modifiers to improve health is to quit smoking. In 2003, in response to high levels of smoking among nurses compared to physicians, the Tobacco-Free Nurses Initiative was formed to support nurses in their own cessation efforts. It was the first national program aimed at providing nurses with education and resources they needed to quit smoking. It has been stated that healthcare providers who smoke negatively affect their patients' smoking cessation efforts in obtaining and pursuing their goals. Nurses who smoke are less likely to teach smoking cessation to their patients. The nurses justify their own smoking habits and don't fully believe in teaching smoking cessation. They are also negative influences on new nurses on the floor and can be detrimental to other nurses on the floor who choose not to smoke. Studies have shown that when a patient is educated by an NP, they are almost 2 times as likely to attempt quitting compared to someone who has not been counseled. Tobacco abstinence can reduce hospitalization and readmissions for cardiovascular disorders. Nurses can play a pivotal role in tobacco cessation interventions among hospitalized patients through evidence-based approaches. Adequate training can improve a nurse's skill in tobacco cessation and thus resolve barriers to adherence. Nurses can partner with other healthcare providers in reducing the preventable mortality and morbidity caused by tobacco use through actively participating in tobacco cessation within the hospital. Many nurses and nursing students started smoking before entering hospitals and other nursing facilities. Creating a smoke-free and healthy environment will obviously help nurses quit smoking, as well as prevent relapse of tobacco use.
Nurses should not be allowed to smoke. Nurses who smoke perceive themselves as not being credible role models to help their patients quit smoking. There are many studies demonstrating that a strong barrier to conducting smoking cessation interventions with the patients is the nurses themselves who continue to smoke and lack the confidence in their ability to support patients in their efforts to stop smoking. Nurses who smoke seem to be less willing to take part in such practices, and they're more likely to hold attitudes that might reduce the efforts of their advice. Nurses who smoke may also be less supportive of smoke-free policy at healthcare facilities. Not only with the policies of these facilities, but patients may have the inability to trust the nurses who are giving them advice about smoking cessation programs. Nurses can carry the smell of smoke back onto the unit in his or her clothing, thus creating possible problems for patients who are allergic to smoke or having to smell the odor. Other patients may simply not like the smell of smoking or of the cigarette, and this can cause conflict in the work environment. Not only that, but it is unprofessional to smoke at work and therefore affects the integrity of the care the nurse is providing to the patient. The CDC estimates that smokers cost their companies about $1,850 extra per year in medical costs and absenteeism than non-smokers. Some companies tack on an extra $15 to $30 per month as a smoker's premium surcharge on a smoker employee's healthcare and insurance. And therefore, it's important that as a nurse who smokes in the workplace, individuals need to be aware that the cost on economically is going to be exacerbated by their smoking, and therefore their premiums will be way higher than non-smokers. And this can cause severe stress on families who may have multiple dependents who has to be covered under their insurance. And so it continues to be a conflict in the workplace of nurses who smoke because of some of these healthcare costs that they have to incur. Research illustrates the perception among colleagues that nurses who smoke take more smoke breaks, spend less time with patients, and are less committed to their profession because of their need to smoke during their shift. At my job, for example, there are co-workers who are nurses that smoke and who sometimes are observed taking numerous smoke breaks, which can amount to more than 2 hours of break time during an 8-hour shift. And this can cause conflict with coworkers who feel like they are responsible for covering these individuals during these allotted smoke times. And therefore, sometimes there is a bit of stress on the units due to a lack of staff during the smoke times. Exposure to secondhand smoke can also be detrimental both to the patient and coworkers. The American Lung Association fact sheet on secondhand smoke exposure cites the classification of secondhand smoke as a cause of human cancer. Secondhand smoke causes approximately 3,400 lung cancer deaths and 22,700 to 69,600 heart disease deaths among adult non-smokers in the United States each year. And as you can see, the lung of in the picture, the lung of a non-smoker, which has adequate perfusion, and the one of a smoker, who of course has decreased perfusion to the alveoli. And so it's important for nurses to take care of their health, but also to not expose their patients to secondhand smoke. And next, Andrew will speak about why nurses should smoke in the workplace.
I'm going to be covering the opposing viewpoint that nurses should be allowed to smoke. A lot of hospitals are making their facilities smoke-free workplaces. They have implemented testing for nicotine that eliminates nurses that smoke in their free time even when they are not at work. Smoking is a coping mechanism against stress for many nurses. There were studies that presented the view that most of the nurses were women who were smoking, and they described it as it was related to the stress they were having at work, dissatisfaction with work, and lack of social support. The lack of being able to control their own work, as well as stressful and high expectations, increase smoking in women. Nurses who smoke need support, and instead they are cast aside as being less capable than their peers. Because of new hiring policies, hospitals would take a less capable nurse over a nurse who smokes. This practice does not benefit the client in the end, and hospitals should strive to hire from the best pool of candidates. Because of the nicotine testing, a nurse could smoke at home, nowhere near the hospital, and still be ineligible for work. Nicotine stays in your system for up to 30 days. Many nurses use alcohol at home to cope with stress with no repercussions from the hospital administration. According to the CDC, alcohol consumption is tied to high blood pressure, heart disease, stroke, liver disease, digestive problems, cancers such as liver, breast, mouth, throat, colon, learning and memory problems, dementia, anxiety, and depression. Just like with smoking, a nurse is expected to teach the dangers of alcohol consumption, while at the same time this nurse could be consuming alcohol at home with no repercussions. During my time at hospital facilities, I've heard nurses talking about alcohol consumption many times. It's often used as a joke. They'll talk about self-medicating. If they had a rough day, they'll probably make a stiff drink when they get home. Patients do hear comments like this, and nurses still educate them on the hazards of drinking. As Georgette mentioned, there's also a financial aspect to having smoke-free facilities. This allows hospitals to spend less on their healthcare benefits for their workers. Smokers pay more than a non-smoker for their health benefits. The financial incentives might be the reason why so many hospitals are adopting a smoke-free workplaces, not the health of their workers or patients. If hospitals really cared, they would be offering smoking cessation programs with incentives to help their staff quit. Many hospitals are not addressing the reason why nurses smoke, and that's stress. There's still high nurse-patient ratios, increasing workload, and no increase in support. Maybe if they would take some of these funds saved from the healthcare, they could put it back into improving the work life of these nurses. Making hospitals smoke-free is setting a precedent that could lead to a forced worker health trend. Legally, a nurse who smokes is not protected by any anti-discrimination laws. In the future, a hospital could decide that all nurses need to have a certain BMI. As we know, BMI is a direct predictor of long-term health. Nurses are expected to teach clients about proper nutrition and the importance of reducing obesity. Obesity is tied to a lot of diseases. If nurses are not allowed to smoke, what is stopping hospital administrators from having a BMI limit on hiring? Hospitals could get a blood test for cholesterol just like they test for nicotine levels. If a nurse has a high BMI, does this mean that they likely will be ineffective in dietary teaching? Smoking is also tied to racial and socioeconomic factors. Hospitals really should reflect the communities that they serve, and not allowing nurses to smoke can affect the diversity of hospital staff. Native Americans have the highest percentage of smokers, followed by African Americans. Over a quarter of people below the poverty line smoke. Whites make up a vast majority of RNs in the workforce, and if we want to diversify nursing, smoking might be a limiting factor. If we're using that as one of the deciding factors of who we're hiring, we might be leaving out certain racial groups.
So, what are some solutions to increase smoking cessation? One solution is 1-800-QUIT-NOW. This is a toll-free number operated by the National Cancer Institute that will connect you directly to your state's tobacco quit line. Quit lines are telephone helplines that smokers can access, often free of charge, in order to speak to trained counselors and receive advice, as well as referrals to other resources. Quit lines have been found to be effective in promoting quit attempts. Another solution is smoke-free texts. Smoke-free texts are for adults who want to quit smoking. The program lasts 6 to 8 weeks depending on your quit date. You will receive 3 to 5 messages per day. The text messages provide tips, advice, and encouragement to help you overcome challenges and stay motivated. Many individuals that are trying to quit smoking usually turn to nicotine replacement therapy. The products that are used contain small amounts of nicotine, and not the hundreds of harmful chemicals found in cigarettes. Nicotine replacement therapy helps individuals handle physical symptoms of quitting by providing nicotine at much lower levels than found in cigarettes. This satisfies individuals' nicotine craving and lessens the urge to smoke. Over-the-counter nicotine replacement options include the patch, gum, and lozenges that contain nicotine. Nicotine inhalers and nasal sprays are also available, but only by prescription. Some medications that help with smoking cessation include Chantix and Zyban. Chantix is a prescription medication developed to help individuals stop smoking. It works by interfering with nicotine receptors in the brain. It lessens the pleasure a person gets from smoking and reduces the symptoms of nicotine withdrawal. If an individual plans on taking Chantix, it's better to start a month before their quit date. Zyban is a prescription antidepressant in extended release form that helps reduce cravings and symptoms of nicotine withdrawal. It does not contain any nicotine. This drug acts on chemicals in the brain that are related to nicotine craving. Zyban works best if started 1 to 2 weeks before you quit smoking.
So in conclusion, when we were working on our 212 project, we came up with the idea for this, and we have seen nurses smoking in the facilities that we've been at. We can smell it on them, and we were wondering whether they should be allowed to. So there is really an ethical dilemma here with the autonomy of these nurses, what they do in their free time, what they do at home, versus what they are practicing and what they're preaching in the facilities. Nurses are an integral part of the healthcare team. As educators, they really are responsible for being professional and to advocate for the health of their patients. Smoking is a modifiable risk factor that poses health risks for both the nurses and the patients who are in their care. In order to live a healthier life, both physically, emotionally, and mentally, the importance of being smoke-free is critical. We felt after doing our research that really it is difficult for a nurse to support the idea that nurses should be able to smoke. There really is no reason. There is alternatives. There is other ways to manage your stress. And smoking is directly detrimental to the health of both you and your patients. And we should really strive for the best health and wellness in our patients. Thank you.